Good morning, everyone. Welcome, welcome, welcome. And welcome to Public Health Advocates 2023 Policy Launch Webinar. We're pleased to have you join us today and are looking forward to sharing with you all what we have in store for our upcoming year. My name is Usama Muqaddam. I'm the Public Health Advocates Director of State Policy, and I have the pleasure of walking you through our program for today. We will have the opportunity to hear from a number of different people who will talk about why Public Health Advocates 2023 policy agenda is so crucial and so critical to the advancement of public health. Over the past 20 plus years, Public Health Advocates, in partnership with many of you all, has worked with communities to establish policies, systems, and norms that promote health and racial justice. We pride ourselves on our focus on bringing a health lens to some of the most pressing issues of our day, challenging the social, political, and economic systems that undermine physical, social, and emotional well-being. With our ever-evolving society, it's more important now than ever to embody this bold approach to challenging our state's most challenging issues. This is the spirit that lives within the policy work that Public Health Advocates does, centering our most impacted communities and advocating for policies that meet their unique needs on their terms. So today I have the pleasure of presenting our 2023 areas of focus, and here they are. The areas of focus that we decided to work on for this upcoming legislative year, which are listed here, are a culmination of many different factors. They're a result of the historical work Public Health Advocates has been a part of, the groundbreaking and innovative efforts we've had the honor of being a part of to address our state's most unprecedented challenges to public health, and our long-term commitment to challenging the ills of systemic racism, which contribute to every aspect of our lives. So first, I'll talk a little bit about emergency response systems. One big area of focus Public Health Advocates has been working on in the past several years has been emergency response. Through this work, we have had the opportunity to partner with research institutions like UC Davis Health and local entities to develop ways to address first response needs. This has culminated in a statewide effort we're excited to tell you all about just in a bit later in this presentation. On the issue of housing and homelessness, we all know that California is going through one of the worst housing crises to date, which was intensified by the COVID-19 pandemic. And it is incumbent upon advocates across the state to tackle this issue head on. Public Health Advocates is committed to ensuring that this issue area is alive in our policy agenda in 2023. Prioritizing bills and budget asks that aim to provide Californians experiencing homelessness with not only housing, but the necessary systemic supports to ensure they are living fulfilling lives. On the issue of racism as a public health crisis, Public Health Advocates has been at the forefront of the conversation on the issue and addressing racism as a public health crisis in California. Building on our efforts from last year, we are committed to ensuring that California's Racial Equity Commission, as a result of the governor's executive order last year, is filled with members that not only represent California's diverse perspectives, but also truly understand the ways in which racism influences our government structures. Only then can we truly address racism as a public health crisis. Additionally, Public Health Advocates is committed to ensuring that community-based organizations, the most trusted and frontline entities serving our hard-to-reach communities in California, are invested in through the Health Equity and Racial Justice Fund. Next, I'll talk a little bit about COVID-19 pandemic recovery. So we're all hearing about the state of emergencies being lifted, and with state and federal state of emergencies being lifted, many are forgetting about the disproportionate impacts of COVID-19 as a pandemic and an ongoing public health crisis. And there are ongoing recovery efforts that aren't being discussed as much as a result. Public Health Advocates understand that prevention and long-term investment are what will allow us to be prepared for the next crisis. The gaps that were exposed in our emergency response systems throughout the pandemic weren't related to our short-term response. The overwhelming majority revolved around our sustainable and long-term abilities to resist ongoing crisis situations. In partnership with our California COVID Justice Team, Public Health Advocates is focusing on establishing long-term solutions to crisis response, such as developing frameworks for crisis response that center our state's most disadvantaged communities. We're continuing to heavily support any legislation that is in line with that approach. And many of you may have remembered some of our legislation last year that aimed to address this issue. And we're committed this year to continuing those efforts and ensuring that we have equity and recovery moving forward. Up next, I wanted to talk about public health prevention. Now, many people, address this in different ways. This being the last, but definitely not least issue area is a manifestation of public health advocates' commitment to looking at new ways to address the gaps in access to medical, mental health, and reproductive services for California. And it doesn't just stop there. In addition to that, food and water access remains a high priority for PHA, as it serves to be an obstacle for large parts of the state's population, especially in our Central Valley. We're also working with legislators to support innovative bills that aim to restrict tobacco consumption for the next generation of Californians, while also, and I believe this is the most important part, maintaining a focus on ending the criminalization cycle for the often disadvantaged communities that are targeted by these products. So now I'll move forward to our budget response. So we've all heard the governor's January proposed budget. And what we know now is that there's a projected budget deficit, not only for this year, but the following year. And we also know with our public health lens that making cuts in the budget significantly worsens disparities. So what we have here is a model for balancing our immediate needs and long-term goals. As far as public health's approach to this year's budget, we recognize the over $1 billion deficit and the significantly higher projected deficit for next year. Taking that into account, we're still focused on the funding that does not get pulled from things that benefit our disadvantaged Californians. Making cuts and significantly worsening disparities will create long-term challenges that will surely cost us much more in the future. Yes, they might fill gaps here and there in the short term, but the long term will be much more detrimental if we don't focus on them now. And lastly, it's essential that we balance these priorities. So we're working with the legislature and administration to ensure our immediate needs as a state are fulfilled while meeting our long-term goals. And you see here, we have a few items listed, some of our priorities, such as housing, which I spoke about, the Health Equity Racial Justice Fund, access to care and emergency response, and then also giving weight to ensuring that we have funding available in the chance that we enter a recession, and supporting the ongoing programs that the state of California is funding currently. So now I'll go ahead and pass it over to Dr. Flaujon Cofer, who is our Senior Director of State Policy, to introduce to you all our feature bill for this year. Flo, you're muted.
Thank you, Osama, and good afternoon to everyone. We are so pleased to have you here. As Osama mentioned, my name is Flaujon Cofer, and I am the Senior Director of State Policy for Public Health Advocates. And I'd like to introduce to you our feature bill for the year, which is AB 1276. A little bit of background on this bill is that the California 911 system receives more than 28 million calls each year, and they elicit a response and dispatch from emergency responders. Obviously, the most serious of these calls are requesting support for things like medical emergencies and fires and crimes in progress. But the preliminary data suggests that most 911 calls are actually out for issues that kind of fall outside of the standard definition of emergencies. They may not be particularly time sensitive, or they may just require a response outside the scope of traditional first responders. And in combination with that, the lack of common standards for data collection and reporting makes it really difficult to assess the complexity in the types of support that are being requested and the appropriateness of the response that's being provided. And so what this does is it really complicates the ability of our state and local governments to ensure that the resources that we have are actually allocated to allow the first responder system to operate with efficiency and to provide the optimal health and safety outcomes for our communities. And public health advocates in particular has a direct vested interest in this issue. With funding from CareStar several years ago, public health advocates began an initiative called the First Response Transformation Campaign to help state and local agencies in California reimagine public safety. And really the goal of the initiative is to focus on prevention by championing systemic changes to make emergency response systems more responsive to community needs, less costly, safer, and just generally more efficient. Now, two of public health advocates' organizational values are we stay curious and keep learning, and we value and use science as our guide. And so our values guide how we work towards achieving our mission. So the first step in this work was for us to learn more about community needs and the current system features. Unfortunately, our learning led us to a dead end. We were unable to access the data needed to make data-driven decisions. And so this bill proposal is in direct response to a systemic barrier that we faced to achieving well-being for Californians. And for those reasons, we are proud to be sponsoring this bill with Assemblymember McKenna. Two, first, require state and local agencies to compile and share their 911 call data. That may seem simple, but it's currently not happening. The second is to create uniform standards for 911 call data collection. Again, the data come in various formats, and so it's really challenging to be able to look at them and to be able to analyze and draw conclusions. And then lastly, to make sure these data are available by establishing a statewide 911 call data portal for research purposes. So to give you more information about the bill, next we're going to hear from bill author, Assemblymember Tina McKenna, representing Assembly District 61 in the Inglewood area, as well as Jane Smith, an EMS professional with 37 years of experience, who happens to also be one of the members of our Equity Advisory Group for the First Response Transformation Campaign.
Hello, everyone. I am Assemblywoman Tina McKenna, and I'm excited to be authoring AB 1276. AB 1276 will begin the process of saving 911 call data to ensure that emergency response systems keep pace with advancing technology. This bill respects the privacy of callers to ensure ethical and transparent data collection, while identifying new ways to ensure the right response occurs at the right time. California needs a uniform data standard across the state for incident data, and this is the first step to improving our outcomes of our emergency response system and allowing for resources to be allocated to ensure that the right response occurs at the right time.
I started as a first responder in 1982, working as an emergency medical technician. 2 years later, I became a paramedic. Today, I am retired, but I have served in many EMS positions. I fully support AB 1276. I believe that the whole is greater than the sum of its parts, as coined by Aristotle. So let me give you an example. In the mid-90s, I worked in DPH Paramedic Division, assigned as a dispatch captain. There we had paramedics triaging all types of 911 calls within our own dispatch center. Subsequently, fire and police also had their individual centers. Eventually, though, fire and EMS, along with police, moved together to create a Department of Emergency Management, or DEM. This meant all dispatchers were co-located to one facility under one unified management team. Ultimately, field responses and communications were better coordinated. The same discussion and conclusion should be drawn for having a standardized metric system for first responders representing EMS, police, and fire. The reality is that today's emergency calls for help are somewhat different than in the 90s. Today, there is an increased number of unsheltered people, increases in drug use, drug abuse, drug overdose, and mental health issues. So today we must ask, who is the best person or persons to respond to these types of calls? The only way to have creative, tailored programs that connect appropriate resources to individual community needs is to have easy access to data, well-researched programs, which result in reimagined first responses.
Well, thank you so much, Dr. Kofer, for that wonderful presentation on our bill, and our esteemed speakers for their very invaluable perspectives. Now, I have the honor of closing out our program here today and letting you all know a little bit more about what's yet to come and what to expect. So in conclusion, here are some things to expect from public health advocates in the coming weeks. And not only that, don't forget that this is a year-long advocacy project. And we're going to be engaging with our advocacy network, our supporters, and our partners throughout the year in so many different ways to ensure that all of our voices are represented within the state legislature, the administration, and elsewhere. We'll be releasing our official policy priority document and sharing it with you all in the coming weeks. And in addition to that, we'll also be sharing essential materials around AB 1276. And what you can expect there is a bill fact sheet, some support letter language, maybe some calls to action to engage with your legislators around advocacy for the bill. And lastly, you can always visit our website to keep up with our bill positions as the year moves along. So thank you so much for joining us today. For more information on our work, you can visit phadvocates.org. And if you'd like to contact us regarding anything state policy, please feel free to reach out to me at om@phadvocates.org. We hope you all have a great rest of your day and week. Thank you.